Hello, this is the presentation for using case-based teaching to increase confidence in managing controlled substances during the COVID-19 pandemic. That is the name of the project here that we've done at the Wayne State University Family Medicine Program out in Rochester. A little background on the project. So the purpose of this project is to increase resident understanding and comfortability with the prescribing of controlled substances, particularly during virtual visits, which are increasingly common during the COVID pandemic. Not being able to properly prescribe controlled substances can lead to poor outcomes, and physicians often feel underprepared to prescribe these medications via telehealth because it's so new. Things we've looked at here, we tried to give some recommendations from both federal and state guidelines as far as how to prescribe these controlled substances. The objective of this project was to increase patient safety by making sure that residents and attendings understood how to legally and safely prescribe during this pandemic, and to increase resident confidence. Specifically, we measured that through the use of pre and post educational surveys. So what we did was actually administered a short educational intervention. It used cases in order to illustrate the different federal and state guidelines. Prior to the case-based educational presentation, we gave a survey, and then afterwards we also gave a survey. Cases were based on actual encounters. They consisted of multiple choice questions, a clinical summary, and post-question discussions. What we found was that after, prior to the education, there was a low amount of comfort among residents, particularly for virtually prescribing these. You can see it was at 9% prior to the intervention, and we increased it to 64% after. With the confidence and understanding specifically COVID policies, 50% versus 92%, and awareness of legislative changes which allowed for prescribing of controlled substances and spacing out some of the different things for how frequently you need to see these patients, we saw an increase from 18 to 71%. So overall, case-based interventions do appear to be beneficial in increasing provider comfort for controlled substance management. Maintaining an interactive component of learning through case-based strategies also improved the learning. One limitation we did find in our study was we had a fairly significant amount of dropout. We attributed that somewhat to survey fatigue. Ours was one of many projects that goes on in the residency, and everyone has pretty busy schedules. So sometimes after, we can get everyone to do the intervention before, and sometimes as soon as we're done giving the intervention, everyone runs out the door, and we're not able to get everyone to actually complete that post-intervention survey. So we did have some dropout, but 63% completed was still fairly good. What we will continue to do is, maybe in the future for further PDSA cycles, which is the model that we used for this project, we might assess and see if the intervention was effective at 6 months, and see if the people retained the knowledge and still remember everything, or if maybe we need to do a refresher course would be an option. But with these new restrictions and in-person office visits, sometimes offices being closed down or not having enough staff due to COVID-19, being able to use virtual case-based learning is going to be important. Thank you for your time.